People need care wherever they are, and needs change over time.
Now, tuberculosis is known as a problem all over. In Balochistan, there was a definite need for eye services. Because I know how often in the beginning when I could do only leprosy, what I have been suffering knowing I could save the child, but I can't save this child.
The story of leprosy control in Pakistan began 52 years ago with the setting up of a makeshift clinic in a Kachi Abadi. The Marie Adelaide Leprosy Center has grown since into an organization with centers ranging from the remote reaches of Balochistan to the far corners of the northern areas in Azad Kashmir.
Actually, I think I can really say there isn't a village, there isn't a hamlet where the leprosy team has not been. There may be a few where I haven't been, but the team has definitely been there. So this was already routine. You can't control leprosy unless you find out when somebody drops out of the treatment why, and unless you examine also everybody who has been in contact with this leprosy patient to stop the spread from the beginning. And these people you can't ask to come to the clinic, you have to go to them. And anyhow, if you have a full rehabilitation program, you have to be conversant with their living conditions of the individual family.
Dr. Fau's pioneering work has done wonders for leprosy control in Pakistan. But leprosy is not a thing of the past.
The disease has an incubation period from 3 to 5 to 20 to 40 years. This means you can get infected today with leprosy, you don't know anything about it, and after 40 years you develop your first patch and need treatment.
Much has been achieved, but work remains to be done for leprosy patients. Another challenge is the control of tuberculosis, a highly infectious disease on the rise in Pakistan. MALC also offers the poorest of the poor the gift of sight. When disaster strikes, MALC is there, whether for flood relief in Sindh and Balochistan or to cope with the devastating aftermath of an earthquake.
जी मेरी दोनों टांगें टूटी हुई थी ना, तो मकान उस वक्त हमारे पास था ही नहीं, सब कुछ टूट फूट गया था। तो 6 महीने में अस्पताल में रही हूँ, 7वां महीना पड़ गया था, फिर मैं उधर से मैं वापस आई हूँ। तो घर आई हूँ, ये बच्चे मेरे जो तंबू में थे। जब मुझे ये चोट आई थी ना, एकदम मैं ये सोच रही थी कि कभी मैं जो है ना अब दुनिया पे नहीं चल सकूँ। मुझे ये अपने बच्चों का भी पता नहीं था। फिर अल्लाह ताला ने मुझे एक दफ़ा फिर नई ज़िंदगी दी है।
10 days after the earthquake, MALC clinics were functioning again.
After 10 days after the earthquake, the leprosy tuberculosis centers, all in all, were already functioning again, intense, because you can't interrupt this treatment.
Follow-up is most important in the treatment of tuberculosis, and MALC makes sure every patient is cared for. Over 100,000 tuberculosis cases have been registered at MALC centers, and 160,000 eye patients attended to. For MALC, the Triple Merger program is the way forward as the organization widens its scope to the general health of an unserved population, providing all services completely free of charge. Prevention is better than cure, and rehabilitation, an important part of the MALC mission.
The treatment doesn't mean doling out medicines. You don't deal just with a bacterium, you deal with a human being. The principle, you first see what the patient himself can do. But then you must involve the family, see what they can do. Then you must involve the community, and then only MAC comes. Yeah? What you all can't do, we will facilitate that you do the maximum, and what you can't do at all because it's specialized, this we will do.
With the expansion of its activities and the provision of better services, MALC needs the help and support of the Pakistani community and the corporate sector.
You know, we are at the moment in a rather acute crisis because as leprosy, our main financial support was the German Leprosy Relief Association. Since leprosy is controlled, of course their funds go down.
MALC is a success story in public-private partnership, but 65% of its budget is still provided by the German Leprosy Relief Association and other foreign donors. But GLRA funding is expected to go down by 10% a year. The program cannot afford to have a break in funding, and it is time to accept ownership. Corporate donors have taken responsibility for a number of centers. Others must now step forward to make this success story their own story.
Not everybody can do everything, but there is nobody who can do nothing.